Sir, please step over here. Tell me who you are, where do you live, and what's on your mind.
I'm Stuart Engel. I live in Asheville, and I'm an independent insurance broker. Have been for 14 years here in Asheville, and I've definitely seen a lot of changes over 14 years. I wanted to just touch base on just a couple things real quick here that have been tossed about in this room. It's been my experience that I've seen a lot of people paralyzed with fear in regards to healthcare reform and what is happening. First off, we've touched on a couple different things tonight, and you've got to keep in perspective individual insurance versus group insurance. They're two different things. And there are options out there with ACA that I've never had in 14 years of being a broker. So I think that there are really good choices for people, but you should not do it alone. I think that healthcare.gov is applicable for people that are between the 100 and the 400% federal poverty level. If you're not in there and don't qualify for a subsidy, then you can go direct and still apply for an ACA compliant plan and end up in a better light than you think that you are. And when you're talking with group in your situation, there's private exchanges which have not even been touched on here. For example, the town of Matthews went on a total private exchange, saved millions of dollars, and everybody in the town of Matthews who were employed there got to pick their own plan, while the entire town saved millions. So I just wanted to touch on the fact that there are a lot of options, but you're not going to find them on your own without a licensed broker, which brings me to the question. Why do we have licensed brokers versus navigators now in this whole system? It's my understanding that a navigator doesn't carry an insurance license, where folks like some of the other folks that are in this room here have gone to school, have been accredited with the state with a license. So how and why does that exist?
And before we get an answer up there, you said it was a lot of fear. Is it fair to say it's fear of the unknown because people just don't understand the information? It's that complex. Is that fair?
Yes, that's fair. People do not understand. I mean, people don't understand the basics between group and individual insurance. Right off the bat right there, and all the way down the line. You should not do this without a licensed professional. That's why we carry a state license.
Cody, how do we make it easier? Can we make it easier? Can we make it more understandable? Or is it just too complex and too complicated that it's always going to be a challenge?
Healthcare is very complex. We've gotten a system that has for decades developed into what it is. I think it both can work equally. The navigators are volunteers, I believe, yes, who are there to help with the basic enrollments in the ACA. I think our brokers are definitely necessary. And for those that can't afford insurance, they should all know that their hospitals are willing to work with them on whatever they need. You know, it's not necessarily going to be free, but some of our hospitals do have really generous charity care policies. So if you can't get on and you need help immediately, your hospital is there to help you.
And I don't want to keep going back to the well all the time, but did you want to weigh in on this quickly, Alec?
Well, I'd say that navigators play a crucial role because a lot of people want an unbiased opinion. And sometimes they feel if they go to an agent or directly to a company that we're going to steer them towards a particular product. So navigators do play that role. Going back to the other point, since July, as this gentleman mentioned, he saw us at a meeting back in September. Since July, we've been running events constantly because that is probably the biggest problem. People are confused. And when people are confused, when they don't know, they get scared, and it causes a lot more angst than it needs to. So we've been actively going out in every community we can to try and explain it. Not all of it is easy. It is very complicated in a lot of areas, but the basics of it are pretty straightforward, but sometimes you need someone there to help you understand what you're looking at.
And just a quick follow-up with Leslie, even though the individual navigators are volunteers, the Department of Health and Human Services gave 105 different groups $67 million to work the navigator program. Do you have any idea where that money was being spent? Sure. Or how it's being spent?
It pays for training. It pays for administration. You know, you don't just say, all right, we're going to train X number of navigators and it doesn't cost anything. When you think about the number of navigators who've been trained for that money, it really is a bargain.
Very good. Thank you very much for the information. And we're going to get back to our viewers at home in just a moment, but I want to get one more question in. Sir, please tell us who you are, where do you live, and what's on your mind.
Hello, my name is David Rode, and Just to give a little bit of background information, I'm the chairman of Henderson County Teenage Republicans. I know I may not be the most liked person in the room right now, but I think
we love you. You're doing a great job.
I think it's important for youth to have a voice.
I agree.
Me personally, I know that healthcare system is broken. I think we can all agree upon that. Excuse me. And I mean, I would like to think this is our country. We vote these people into office. How come we can't fix this ourselves, regardless of political affiliation? Because I mean, we're all beating each other up and not getting anywhere, and I don't like it.
I agree.
It's not good for the country. It's not good for us, and it just makes us look bad.
That sounds like an applause line to me.
I think so.
Well, my question to everyone in here and to the panel as well is, I've always thought, what can I do and what do I think if I had any power to adjust something in this law? What do you think could be tweaked to make this a better law? How can we make it a better law? How can we make it work? Personally, I think that the law in the current state is not the best idea. But again, as I said, I believe that the system is broken. It needs to be fixed. I just don't think this is the right way to do it. So that's my question.
All right, well, I want to go to Donald with this. And by the way, he made a comment about, well, politics. Is this 2 parts policy and 1 part politics? Is that part of what's going on here? And then how would we fix this if we could?
Yeah, no, it's absolutely policy and politics. Of course, my side is advocating for the full repeal of the Affordable Care Act. I mean, that's just where we are on this. And then, you know, you also have Republicans and Democrats just wailing on each other. Republicans think, you know, Democrats are trying to take over the country with take over health care, and we're going to have death panels and things like that. And Democrats think that Republicans are trying to let everybody die on the roadside. Obviously, those are 2 extremes, and neither of them really get to where we can fix health care. One way that this law could be fixed or be made better is actually advocated in the new health care plan put out by Senators Burr, Hatch, and Orrin. Senator Richard Burr here in North Carolina signed on with it. And what that law does, it's sort of a fix to the Affordable Care Act. And one major thing that it does that we really like is that it block grants Medicaid. The states have been sort of treated as an administrative arm of the federal government in administering Medicaid. They can't really do anything. They are given the money, they pay it out in the Medicaid program, but they can't really change or innovate how it's paid out or how the program's run or anything like that. In 2009, Rhode Island was given a special waiver on Medicaid, and they were block granted Medicaid. They were just given a huge pile of money for all the Medicaid people in there, but they could innovate in how it was paid out and how the system was managed. In the first year alone, they were able to innovate and find new ways to manage the system, and they saved $100 million a year in the tiny state of Rhode Island. I can imagine we can do just as well, if not better, in North Carolina if Medicaid was block granted and given 1 chunk of money and allow the state to better manage it rather than just be an administrative arm of the federal government.
Well, let's go back to the original question. What would be some of the ways you would think the law could be improved? Suggestions?
Well, I still think there should be that public option to let somebody buy into Medicaid, the government's very popular, Medicare rather, the government's very popular single-payer system. In Australia, I have a friend who lives there. She said, boy, I wish I could afford private insurance, but I sure am glad I have the government insurance because it saved my daughter's life. I paid $50 for her surgery, and 40 of that was parking. It's important to give people that option. And, you know, so you don't get the bells and whistles. You have a semi-private room instead of a private room, but you don't die the way my son did. If you want bells and whistles, like in Australia or even in Canada, you can go to a private insurer and you can buy insurance that gives you that private room with cable television, phone service, and a better menu. But you don't die. Like before the Affordable Care Act took effect, 45,000 Americans died every year, 1 every 12 minutes, because they couldn't get health care. I mean, wouldn't you prefer to be able to buy into Medicare and get something rather than be told, I'm sorry, you have to pay cash up front or die? And that has happened. It happened to my son.
Your friend in Australia needs to pick a better parking garage.
Yeah.
A lot of folks at home want to join this discussion, so let's go to our digital desk. Frank, what do you have for us?
Well, Mark, we're hearing a lot on that last question you posed to folks about whether or not the government mandates are the best way to maximize consumer health care choices. And I want to share some of those comments with you, but first I want to remind folks at home that they can get involved with the town hall. They can do that at facebook.com/news13, or they can do it at Twitter at WLOS_13, and also at the hashtag WLOS Town Hall. Now let's take a look at some of the comments we're getting from our Facebook page, and this is regarding that question about government mandates. And Karen writes, "No, my freedom means more." And then we get a comment from Junior, and he writes, "Yes, plenty of successful examples throughout the developed world." Now I want to turn over here to Twitter, where Philip Gregg added a comment. "My sister tried to get coverage through the federal system and was denied. They wouldn't even tell her why, just said appeal." And AFPNC posted this comment: "Medicaid surgical patients are 13% more likely to die than those without any insurance at all." So those are some of the comments we're getting, and I want to share the snap poll with you about that question. When you asked, do you agree government mandates are the best way to maximize consumer health care choices, 67 of the people so far that responded with an answer said no, 3 said yes. We've had over 850 comments on that question. Now I want to leave you with this last question, if we can bring it up on the screen. Why, and this is from Roy Jensen and Fletcher, why is everything in the Affordable Care Act age dependent? Fees, services, medications.
Can you repeat that last part?
Why is it that everything in the Affordable Care Act is age dependent? Fees, services, and medications.
Alex, is the Affordable Care Act age dependent?
So, insurance plans are based on age. The older you are, the more expensive the plan is. Now, with the Affordable Care Act, it's shrunk the difference between the lowest cost, so someone who's young and very good health, and someone who's older. It's shrunk that difference between the plans. But the other part of the question, services and medication, I've never heard of someone going into a pharmacy and paying more for drugs because they're older, or paying less because they're younger. I think that would be illegal or unethical at a minimum, and I've never heard of anything like that. So I can say that the cost of the plans can vary, but the subsidies, if you qualify for a subsidy, increase as you get older to offset the higher cost of the plan itself.
You wanted to weigh in on this, Cody?
I was just going to agree. I don't believe that those age variances are in there at all. So.
All right, and now we're under 30 minutes for the rest of this discussion tonight, so we're going to get into the lightning round. So I'm going to ask for questions just a little tighter, a little shorter, answers a little shorter, because I want to get as many questions in as possible. Sir, please step up with me. Please tell us who you are, where do you live, and what's on your mind?
I'm Skip Edwards, and I live in East Asheville. I'm 64, my wife is 63, and we are absolutely benefiting from the Affordable Care Act. For the last 3 years of our life, our number one worry and concern was insurance, because we both have pre-existing conditions. However, January 1st, we have a policy, a gold level, if you've been to the healthcare.gov, and we are saving $500 a month through the subsidy tax credit. Makes a huge difference in my life. I'm sure it would for most people. My question is, I want to shift the dialogue or the discussion to more on a moral level. And I find that access to healthcare is a moral right. And I find it greatly offensive. Donald, your organization and the Republican Party opposes it on some vague thing of the free market and people should have more choice. That's great if you got the access. But if you don't have the access, you're screwed. And when the gentleman talks about he's alive today because of care and insurance, a survivor of cancer, who and what families are exempt from healthcare problems and crisis? It stops the world for where you are. So I just want to know, especially you, Donald, what moral right do you pretend to have to deny access to millions of people across this country?
Well, Donald, I think that question was sent your way.
I don't propose to deny anybody access to health care. That's why one of the things that Americans for Prosperity advocates for is amending state certificate of needs laws. Let's be clear on what this law is. It is where the state government, you have to go in, if you want to open up a hospital or a clinic or any type of medical facility, you have to go before a board of the state government, and they have to tell you if there is a need for that facility or not in that state. 36 states have these laws. Now, what that does is that it limits the amount of competition that can be in the marketplace. So if I'm a doctor and I want to open up a clinic here, I have to go to the state board and they can tell me yes or no, and then I have to appeal it if they say no, that I can open a clinic. What the basic laws of supply and demand means that if there's more supply of medical care in a place, then all they can do is try to drive down costs in order to compete for more customers. This type of law is crony capitalism at its finest, and that is one of the reasons why healthcare costs have continued to go up. It's a way that we believe that healthcare can be more accessible for people. We oppose this law on the fact that we think that it forces a lot of people into things that they don't want. It's literally, it's run by their taxes. If you don't pay your taxes, if you don't pay the tax penalty, then you can be jailed and fined by the federal government. We think that that is immoral. We're not trying to deny people any access to health care, and I think that accusing us of that is sort of morally reprehensible in and of itself. But what we want is more access, and we think that healthcare needs to be reformed, but in a much different way than the Affordable Health Care Act is doing it.
Okay, and I'm going to have to continue on with the lightning round here because we're running out of time, so I want to get as many questions and answers in as possible. Please step up. Please tell me who you are, where you're from, what's on your mind.
My name is Milton Butterworth. I work with Blue Ridge Community Health Services. We're a community health center like Scott's organization in Asheville. We're in Hendersonville, and I agree with a lot of the things that have been said in terms of, it's not a perfect law. I think it's something that we can all work on and make better over the years. But I do want to give everybody kind of a little bit of a positive feel in the time that we've been working with the public and trying to...
It better be a short positive feel because I'm running low on time.
Okay, great. We basically have helped over 3,800 people understand the Health Care Act a little bit better.
Your navigators?
Yes.
Okay.
And over 400 have actually completed an application. And so there's a lot of positive signs for the 13,000 uninsured people that we serve every year.
Very good.
That's it.
All right. Thank you very much. And I had this gentleman, if you step on over here, please. And we're getting through as many questions as possible. Please tell us who you are, where do you live, and what's on your mind.
I'm David Trout. I live in Weaverville, and like my friend Russell and many of the navigators here, I'm involved in this. I'm an independent agent, and I just wanted the panel to address the urgency of March 31st, the end of open enrollment, and what that really means for folks.
Leslie, March 31st, what's that date mean, and what's the significance for people in this room?
It means that open enrollment is over. And unless something in your life changes, there will be a 6-week open enrollment period every year, and you can always sign on during that, but not outside of that unless you've lost a job or lost insurance or there's been another change in your life that will allow you to enroll. So you really want to enroll by March 31st. It's really, really important.
Anything you want to add to that, Alec, or is that good?
Yeah, I think there was a lot of press right up to December 31st. A lot of people assume that was the end of it, but it actually goes till March 31st. Also, it's your last day to get insurance, and if you don't get it by then, you're going to face the penalty that we've discussed with the mandate, the tax penalty for not having insurance. So you want to make sure that you get it done by March 31st to avoid that.
All right, we're back to the audience. Sir, please tell me who you are. I've got this. It's my job here.
Mike Me in Oldport.
And your question
I actually have a quick comment and a question. Referring to the $65 a month Cigna plan that woman lost and was talked into a multi-$100 plan, there was a profile on CBS not too long ago, a couple of months, with a woman who had a $54 a month Blue Cross Go Blue Plan 91 and a $54 a month that really gave her nothing, and was talked into a $591 plan by Blue Cross. Somebody saw that, went through the Affordable Care Act with her. She now has a silver plan with one of the 3 major insurance companies that with her $320 a month subsidy, she's paying $165 a month and actually has insurance. The question I have is this. It's my understanding that with respect to the nurse's comment about premiums, that insurance companies cannot raise premiums by more than 10% a year without getting pre-clearance from the state. Is that not true?
any premium increases always has to be approved by the state. In North Carolina, we always have to go to Department of Insurance with whatever rate increase we want, and they look at the books and decide if they'll approve that rate increase. If they don't, then they determine what they feel is an appropriate rate increase. So that's the way we've operated for years and years.